Have a family history of breast cancer?
I do. My mother.
Do you know how old she was when she was diagnosed?
I don't remember. I was very young. I don't know how old she. I'm assuming still in her 30s.
Okay. And your aunt, was that on your mother's side or
It
your
was
father's?
my mother's sister.
And do you know how old she was when she was diagnosed?
I'm assuming 38. She passed when she was 39.
Okay. And then you can cover up. And we normally take 4 pictures, 2 pictures of each breast. If I have to take any additional images, don't get concerned or worried thinking I've seen something bad. It just means either your whole breast is not fitting on the image or that I need to get a better position, okay? So don't get alarmed if I take more than 4.
Okay.
Okay? I'm going to let you go ahead and come right up to the front of the machine. Arms are just going to be straight down by your side and just relax as much as you can. Let your shoulders just kind of hang loose, okay? I'm just going to bring the machine up a little higher. Now I'm going to start on the right side.
Okay.
So we're just coming straight into the machine. If you'll turn your face away from me so that I can get you as close as I can up to the plastic. Now this is going to be really tight, uncomfortable, but it's only going to last a few seconds, okay?
Okay.
So bear with me, remembering the tighter that we can do this, the better the images are,
Okay.
and the more we can see and less chance of missing anything.
Okay.
There we go. Really tight, sorry, I don't mean to hurt you.
That's all right. I'll live.
Oh, just like that for just a moment. Great, and you can sit back and relax just a little bit and cover up. Just let me check this image and then we'll move on to the left side. Takes it just a minute to pop up. Okay, great. We'll move on and do the left side. So you're going to scoot a little towards me. And again, just all the way close. Bring your face down towards me. Relax that shoulder. I'm actually going to switch sides here. Just want to make sure we're getting all the tissue in. And we're not missing anything.
Now that was
I'm
tight.
sorry. Oh, just 1 second. I promise I don't mean to be hurting you. Just want to make sure we get really good images for you. Okay, you can relax and you can cover up. Just let me check that image. Then we'll do our sideways pictures. You're halfway done. Goes pretty quick.
Halfway. Wasn't too bad.
You're doing awesome.
Not as tight as you think it would be.
It's uncomfortable, but it's only for a few seconds. And it's not the worst thing in the world, I don't think.
Being an athlete, you break hands and twist your ankles.
Lots of things worse.
Yes.
Okay, I'm going to turn the machine a little bit sideways. And what I'm going to have you do is to take your arm completely out of the side of the gown.
Okay.
And then just go over your shoulder and they're holding you back. I'm going to bring this down a little bit so you can get your arm across just a little more.
Okay.
Really into it and just kind of lean back on it. Perfect. Now again, this is going to get really tight for you.
Okay.
Raise it up just a second. Sorry. I don't mean to hurt you.
That's all right.
Hold your chin up really high so we don't get any shadows. Just like that. Great, you can relax and you can cover up.
Oh, now that one was a little rough.
I'm sorry, those normally are a little bit tighter when we start squeezing on the pec muscle. It doesn't like it so much.
A big biceps. Biceps.
And we're going to get one more picture of the right side.
Okay.
So I'm just going to turn the machine in the opposite direction.
It's really not that bad.
It's just uncomfortable. I do promise to try to go fast though. Like I can't promise it won't hurt. I can promise it'll be quick. Go ahead and uncover this side. And again, let you just raise up your arm. One more time, really tight. Again, chin up high. And you may relax and you can cover up.
Okay.
Alright, if you want to go ahead and have a seat for just a moment. I'm going to give you an envelope if you can put your name and address on it, and this is because we're going to be sending you results in the mail within a couple of weeks.
Okay.
We'll give you a letter, And you're also going to get a message to your doctor, and they'll get their results faxed within a couple of days. So if there's something to be concerned about, you're going to know it from your doctor probably way before you even get the letter.
Gotcha.
Okay.
For your age group, very typical, and that just means you have a lot of breast tissue.
Okay.
You have a significant family history. Your mother and your maternal aunt, and both of them in premenopause. So my report is going to recommend, because of your risk, either an MRI of the breast or what we call a nuclear medicine examination, specific exam. It's different than MRI, but it also examines the breast bilaterally in high-risk patients. And these are the two that are recommended by the American Cancer Society. If you go onto their page for high-risk screening, they recommend MRI. And in some cases, what some of the places will do, like MD Anderson, a mammogram, an MRI, a mammogram, MRI every 6 months.
Okay.
So there are high-risk clinics that actually do that, particularly with the breast that sends to shores.
Okay.
And that's just you being female.
I understand.
Thanks.
So,
Do
okay.
you have any questions?
I don't.
Okay, thanks.
Thank you so much.
It's so nice to meet you.
You as well.
I saw you play when you were in college. I'm from Ohio State.
Oh, yeah. Awesome. Well, you know, I'm from Columbus, Ohio.
Really? I didn't know
Yeah, I'm from
that.
Columbus. I just went to Penn State.
Okay.
I didn't want to be a Buckeye.
Well, we go back up to all the home football games because we have a star athlete.
Okay.
It's nice. So,
I do cheer for the Buckeyes.
thanks. I cheer for
I
Joe.
am from Ohio. So
Well,
have
and
to cheer for-
I cheer from Joe Pop, but I'm from Pittsburgh.
Oh, okay.
So, big history of two
Yes.
quarterbacks from my high school playing for them. So,
Good.
it was so nice to meet you.
You as well.
Thanks.
Thank you again.
You're welcome. Okay.
The biggest thing is early detection. And the lady that I met, very inspiring story in the sense that San Antonio, well, CHRISTUS Santa Rosa offers a mammogram, I guess mobile mammogram, that you can go get a mammogram, and that's actually how she got detected. That was very inspiring to me. I mean, I was very amazed that that's how her life was saved, through early detection. So I would think just meeting the survivors was just early detection. Take 5 minutes, 15 minutes, whatever it may be, and go get tested. Go get your mammogram and hopefully save your life.
Now, what's the most important thing that you got out of your visit today besides the early detection for you personally?
For me personally, it's just that I am high risk, which I already knew, but that just other alternatives besides the mammogram. Because I came in and got my mammogram today, because I am high risk, it was just, there's other alternatives, other procedures that needs to be done to hopefully help save my life and detect it early. But just coming here was just an awesome experience. And to tell people it's not that bad. It doesn't really hurt that bad. Just pinch yourself a couple times and get yourself ready. But the mammogram really wasn't that bad.